conversation with me today is Professor PRIYA Soma-Pillay, who heads the Maternal Health and OBGY divisions at Steve Biko and two other Gauteng hospitals. So today we unpack the role of women in crisis situations, especially in the very volatile health sector of South Africa. This conversation goes directly to the issues of humanity and humaneness. It is about how we treat the vulnerable and create a space for all people to inhabit their full humanity. So thank you, Professor Soma, for making this time to be with us today. You know, if you look at South African society, there needs to be a shift in the way in which we restitch the social fabric of our society. And it's, of course, it involves a slow and soft work at the coalface of norms of masculinity, of violence, of state capture, of corruption, etc. And of course, we have to deal with the generations of the impact of the trauma of our brutal past, plus a very difficult present in which we find ourselves. And in all of this, we need courageous people to stand up time and time again, you know, to diffuse situations and to introduce a new way of living in South Africa. So as an introduction, can you perhaps just tell us a little bit about yourself and the work that you're doing and how that impacts on building an ethical foundation in your profession?
Good afternoon, and thank you for inviting me to participate in this research. I'm a obstetrician and gynecologist and maternal and fetal medicine subspecialist. I'm the head of obstetrics and gynecology department at Steve Biko Academic Hospital in the University of Pretoria. I'm also the chair of the School of Medicine at the University of Pretoria, and I'm the president of the College of Obstetricians and Gynecologists of South Africa. I'm also the immediate past honorary secretary of the South African Society of Obstetricians and Gynecologists. In terms of my role, I'm quite involved in women's health, promoting women's health and health advocacy. With my academic background, I think we can use our evidence-based data to ensure that we promote women's health in South Africa, but also in Africa. In terms of an ethical point of view, the principles of ethics come into play when performing research, when practicing medicine. And we need to see from an ethical point of view that what we do for women in South Africa, not only as leaders, but as academics and researchers, that we ensure that that there's universal health coverage, that our women in South Africa have access to healthcare, and if possible, the best and quality healthcare. So through my work as an academic researcher and my involvement in other societies, women health societies in South Africa, I hope that I can play a role in promoting women's health and reducing our maternal mortality eventually. Thank you.
So as an African woman, do you think that your approach to interventions in times of crisis or conflict is impacted by particular ideals that are implicit to your cultural background?
I think cultural background and values can shape an individual's approach to conflict and crisis interventions. As an African woman of Indian descent, we were brought up with a strong leaning towards the collective rather than the individual. So communal values such as unity, harmony, and respect are quite important. And in times of crisis or conflict, I think drawing on existing relationships and an input from a wide variety of sources is important before we make decisions. Women also play critical roles in community-based interventions. They need to draw on their relationships and networks to bring people together and resolve disputes. They may also prioritize collective solutions over individualistic ones, and in the end seek to restore social harmony and maintain relationships.
So this is quite phenomenal because, it shows a different approach altogether. And if you consider yourself now, I mean, you're in a very male-dominated space, a very male-dominated environment. This particular, as an African woman in a largely male-dominated environment and of Indian descent on top of it, so we also carry our own patriarchal impacts coming in from the interpark continent. Is there space for your spirituality and beliefs to impact on the social justice, development, issues of peace building? Because, I mean, the health sector is a very, in a way, in many ways, a violent space, if I could say, if you look at South Africa per se. So is there a way for your spirituality or beliefs to impact on the social justice, on development, peace building, and even humanitarian projects that you identify and participate in the position that you are in?
I think spirituality and beliefs can play an essential role in shaping an individual's values and motivations, including their commitment to social justice, development, peace building, and humanitarianism. For women working in a male-dominated environment, their spiritual beliefs and practices can provide a source of strength, resilience, and inspiration to continue their work and overcome obstacles. But these also come with challenges, and African women, particularly, and women in general, may also face discrimination and marginalization based on their gender and religious identities. And this can limit their opportunities to participate fully in certain areas. I also think it's essential to recognize the diversity of spiritual and religious beliefs within African communities and to create inclusive spaces that respect and value these differences. We still have a long way to go to ensure that we have more inclusivity and diversity.
What then, in your opinion, should be the criteria, values, or goals in determining any intervention? Because in terms of medicine and the health sector, we need a lot of intervention, and interventions which tap into social justice, social cohesion, nation building processes. Because during COVID, we saw, very terrible things happening in terms of the health sector, and it affected large swaths of people, but also it affected, I think, in many ways, the psyche of South Africans. And the question was, can the health sector deliver selflessly, or is it only focused? And we know that comes from the ordinary nurses, the medical professions, etc. But those in charge, in the administrative positions, the politicians who made the decision, etc., gave our health sector a very, very bad very bad impression. It gave us all, as South Africans, a very bad impression about the public health sector.
Those were challenging times, and I think if we look at values and goals, there's a few that need to stand out or that we need to work towards. The first is equity and fairness. Second is respect for human rights. Other goals such as inclusion and diversity and participation in decision making. In terms of equity and fairness, I think interventions should promote fairness and equity. We should address structural inequalities and ensure that everyone has access to resources and the opportunities necessary to achieve their full potential. What we saw, particularly in the maternal health sector with the lockdown, we saw women from urban areas migrating to their homes in rural areas. And even a lot of our focus was based on the urban hospitals, which couldn't cope. But the rural areas had a much worse experience. So women migrated, and we saw this migration of women from urban to rural. And the rural areas were overwhelmed with women coming to deliver there. We need to see that our resources are distributed fairly and equally. It's also important that one of our goals are respect for human rights. And intervention should respect and protect human rights. And this includes civil, political, economic, social, and cultural rights. Like I said earlier, inclusion and diversity is important. And our intervention should value and celebrate diversity. We should promote inclusive societies where everyone is treated, respected, and valued. I think one of the important with the COVID pandemic, one of our challenges was the issue of vaccination, and how do we promote, and how do we advocate for and overcome the issue of vaccine hesitancy. I think there were a lot of myths and unscientific data out, out in the social media and everywhere. And I think we need to, in this case, respect human rights and respect what people believe, and not judge people based on their spiritual or religious beliefs. It's also important, like you said, the administrators, health administrators, gave us a bad name, or gave the health sector a bad name. And I think how we can overcome this is that if we get the public involved in decision making. So there should be participatory decision making, and intervention should involve communities in their decision making process. And we should ensure that their voices are heard and their perspectives are considered. So I think there should be more community engagement in our health sector. There could also be accountability, and I think that's where we lack in South Africa, and our health sector particularly wasn't really accountable, but we were in a crisis situation, and I think there was a lot of panic out there. But our intervention should promote accountability and transparency. It's also important that we should empower our women and empower our communities. So we should, I think, and the only way we can empower our people and our communities through education. If we educate our women in our communities, we can ensure that they take charge of their own lives. What we saw in the pandemic is that prescriptions, particularly for contraception, declined significantly. And in our health sector, particularly in the ONG sector, we saw a lot of unwanted pregnancies, unsafe abortions taking place. And in this situation, and our teenage pregnancy rates rose quite significantly. Yeah. If we empowered our women and educated our women, we wouldn't have seen this decline in prescriptions and then the loss to follow up in terms of reproductive health care.
Certainly, there was a consequence to the lockdown and the lack of education, of course, lack of access to resources, and as you say, inequitable, distribution of resources. And I think these are many things that people don't even think about or even begin to understand if you're not directly involved in this particular profession or in these particular spaces. And so, if you look back now, and then if you look at your position today, and I'm sure that for many people in hindsight, COVID taught us very many lessons. What qualities do you believe should a woman in the corporate or professional sector in an NGO encompass in order to contribute meaningfully to issues of crisis, conflict, equity, justice, etc., as a social partner with the state? Because you are in the position that you are, you're a social partner to the state. First, you are part of the employment of the state, but in many ways in the extra bodies and organizations that you represent and you sit on, in many ways you have a partnership with the state. So what skills do you think that women who are sitting in these positions should be adapted? And even as part of the administration in a certain department in a public sector hospital, what skills should you be adapted, and what training or experience should such women have in order to make sure that, ultimately when we function as individuals in the broader space, we're contributing towards a better South Africa?
I think women are probably have a bit of an advantage because they have certain skill sets that men don't have. And one of them is empathy. I think a woman social partner should possess the ability to empathize with people affected by crisis. And we saw this in New Zealand with Jacinda Ardern. She was seen as being out there with people. She was seen even with the terrorist attack on the mosque, she was out there with the communities. And I think women can be seen or are seen as being more empathy or more, they show more empathy than men. I think women also are probably more flexible than men. And women social partners should be flexible and adaptable. And they should be able to respond to the changing situation and evolving needs, particularly in the crisis situation. This is probably not the only crisis that we're going to face in South Africa. So we need to learn to adapt and be flexible and change sometimes our way of thinking, but adapt our leadership to fit in with the needs at the time.
Yeah, that is very profound. Yeah. Yeah, no, I agree with that. That's really profound, because what we see in many instances, there are stories that we can write volumes about it, how the leadership keeps doing the same things over and over again in the same way, and it's not making an impact. It's not changing. It's not, improving the lives of people. And you wonder, guys, don't you read? Don't you look? Don't you see? Why can't you see that something different needs to be done? So if you consider the fact, again, coming back to the whole issue of patriarchy and the position in which you find yourself, do you believe that despite being surrounded by this deep system, this endemic system of patriarchy, that women can be effective in addressing the challenges in these situations? Are we making a difference? Are women making a difference?
Definitely, we are making a difference. And I use the example of Jacinda Ardern in New Zealand, and I think she's made a significant difference to the people of New Zealand. She shows strong leadership qualities with certain skills and adaptations that I think are probably more unique to women. It's also important for us, or for women, to have some technical expertise as we are progressing more in the field of artificial intelligence, and as our technical abilities improve globally. But I think we could see how Jacinda Ardern, or how the pandemic was managed differently in places like New Zealand compared to countries like the US, where it was quite a male-dominated, sort of forceful way of bringing down or making rules and making decisions. So I think women can be very effective in addressing the challenges of conflict, unrest, and in crisis situation, even within patriarchal contexts. And there's growing recognition of the important role that women can play in promoting peace, security, and sustainable development, as well as addressing the root cause of conflict. Firstly, women have unique perspectives and experiences that can contribute to a more comprehensive and understanding of the issues at hand. So I think women can or do understand issues at hand quite well. They are more attuned to the needs and concerns of the most vulnerable populations, such as women, children, and I think the elderly. Secondly, I think women have shown that they are effective in mediating conflicts and building bridges between groups of people or different groups of people. They can leverage their networks and relationships, and I think they can facilitate dialogue and negotiation just because they have those qualities of empathy, sympathy, and this can be effective in promoting mutual understanding and trust. Thirdly, women are often key agents of change within their community and can play a vital role in promoting social cohesion, resilience, and sustainable development. I think women are often quite more involved in community-based initiatives that promote education, health, and economic empowerment. And we see in many communities, we've seen this a lot in the Western Cape, where women are actually the drivers of the soup kitchens. They fed many children during the pandemic. They assisted with reproductive health needs of many of our young teenagers. And there were many of these NGOs are actually run by women. So despite the many challenges that women face in patriarchal contexts, they've proven time and time again that they can be effective change agents.
So, if women are change agents, change agents, do you believe that that in the sector that you are in the health sector, and specifically relating to maternal health, to the development of women with relation to their health, can women then, or have women made some kind of a strong stand in terms of holding the state accountable and in pushing for a more participatory democratic process? Your example specifically, like maybe when it came to vaccine rollout for pregnant women or to the children, or in any way the decision-making processes that happened under your watch, do you feel that there was a strong pushback against authoritarian or authoritative decision making, patriarchal decision making, and that you stood up as social partners, as business, NGOs, and did you yourself, Professor Soma, and your division in your organization, did you partner with other organizations to bring something better to the people that you were working with?
Yes, so I think women were strongly represented in NGOs, in societal groups that drove the health side of the pandemic. We knew nothing about COVID-19, and we had to respond very rapidly in terms of research and collating data to help us to drive our fight against this virus. Mm-hmm. So in a very short space of time, we had to collect data, analyze the data, come up with treatments and preventative measures, come up with vaccines. So in a very short period of time, a whole lot of both scientific and medical knowledge had to be developed. Women were at the forefront of this. In terms of the Ministerial Advisory Committee, I was part of the pregnancy group. We had our SAPRA, who is headed by a female woman, and that's the health regulatory body. Mm-hmm. Our research is the MRC is driven and chaired by a female in South Africa, which is Glenda Gray. Our medical association, SAMA at the time, was headed by Angelique Coetzee. So women were at the forefront of the drive in the pandemic. Mm-hmm. They played important role in decision makings, important roles in the science, the development, and the rollout of vaccines. We had to quickly authorize and regulate drugs that came over and vaccines that came over from other countries. These had to be approved by our regulatory bodies. And if you look at many of the organizations, including SASOG, which I am a part of, we have women at the forefront making important decisions in the pandemic.
Well, this is amazing. I mean, I didn't know, about this, and I'm really thrilled to know about this. So when you look at the role that women have played, what from your personal experience, and I'm sure you had very many personal moments during COVID-19, can you share any of your experiences, thoughts, or interventions, and the lessons learned for you particularly? Because there is talk about, another pandemic in the next decade or in the next 15 years, and surely we need to have learned from this one so that we're better prepared for the next.
I think besides collating data, developing research, informing the public, it's also important that your staff and your team are well cared for, and that they are reassured that they are safe, and because they were at the forefront of the pandemic, looking after patients, and they were exposed and vulnerable. So as a female leader, I had a department which spans over 3 provincial hospitals in Gauteng, some of them being some of the largest hospitals in the country. So Tembisa Hospital, Calafong Hospital, and Steve Biko Academic Hospital. And Steve Biko, initially in the pandemic, was declared one of the COVID hospitals for Gauteng. We had to suddenly place our doctors there. And it was important for us then to look after their mental health, reassure them. But I think this is something that a woman can do. And we can listen to their stories, we can listen to their concerns, and we have a role to play in reassuring them with, I think, with the data and the academic background that I have. I was able to reassure them and assure that they are doing not only a good service out there for the community, but we're providing evidence-based care for the community. But I had to see that my team was well looked after, both from a mental and physical point of view. So we had to also try and bring some kind of relaxation into this difficult period of time. And one of the things that we did at our hospital, which we started in our department, was the Jerusalem dance. And we sent out a challenge to various other departments and hospitals, and they all followed. And I think during the pandemic, something small like this made a difference.
So it was all about boosting morale and reassuring the people that you work with and ultimately who works with the public, that they matter, that it's not only the patient, but the health worker themselves are important. And that was for you an important lesson. So in terms of intervention processes, like if you look at future intervention processes and policy implementation in your work environment, what do you think is crucial for you as a female leader in this particular sector?
So we had to come up very quickly with guidelines, frameworks for managing the pandemic. So what is crucial for us is to quickly collate data with any new crisis or intervention, develop a policy framework. We need to have a strong team. So you need to have people who are prepared. I think data collection at this time was important, so that we can, in a short period of time, somehow practice evidence-based medicine and ensure that we providing our patients with the best possible care. If we look at the waves and the way and our mortality and hospital admission, that's with some of the waves, we saw that our maternal mortality rate increased by about 35% during 2020 to 2021. This was the second and third waves were actually worse than the first wave. And we probably didn't learn enough from the first wave because the second and third waves had a much greater impact. So for future pandemics and for future crises, we need to build on these experiences. We need to take all this information, assimilate it, develop guidelines, and be prepared for future pandemics. I think climate change is something that we need to look at. We need to look at how climate change is going to affect the health sector, because there's sufficient data that we are going to be impacted and affected by other health crises in the future. So we need to use this to develop our health systems, make them stronger and more resilient for future crises situations.
So that's also, in a way, a scary scenario, because if you're not doing the preparatory work now, it means that we can be in a worse off position than we were in 2020 and 2021. So, go ahead.
We saw that we didn't learn enough from the first wave, so that our second and third waves were much worse than the first wave. And then eventually things got better at the end of December 2021.
So now I have one pessimistic question and then a more optimistic question. And let me start with the negative one. So the negative one is that, much of what's happening in South Africa is about doom and gloom. And 2 or 3 of the women that I interviewed, they said to me that, you also need to focus on the positives. And you need to look at the good work, because there's a lot of people doing a lot of good work, and especially in the health sector. What is your opinion about that?
I agree. There's a lot of doom and gloom out there. People can be, morale is low. We're living through difficult times. In our hospital, the budgets are cut. Sometimes our theatre time is cut, and people feel many people out there feel that they may be in a worse situation than they were probably 10 or 20 years ago. But you have said, I think we need to look at the individual and the small group achievements that are taking place in South Africa. Don't look at the collective as a whole. Look at the small group's achievements and look at small milestones and small improvements that are being made. Before COVID pandemic, our maternal mortality rate came down by 20%. We're making great strides in terms of our HIV treatment, for example. Our mother-to-child transmission rate is less than 0.5%. We're one of the leading countries in terms of HIV rollout. We are affected by other conditions like non-communicable diseases, but I think there's more women and more of our population who have access to healthcare now. We have more children who are able to read and write. We need to look at things like that. And although overall we're faced by doom and gloom, we need to look at we need to look at the detail rather than the overall picture.
So the last question, just as a wrap up, there is still this image that the public health sector is absolutely crumbling. It's in shambles. And you, like you said, you're in charge in your particular division on 3 of the biggest hospitals in Gauteng. And many people said, Steve Biko, Califong, etc. These were like good hospitals many, many years ago, and they've completely deteriorated. And that is also because administrative people and individuals in charge of medicines, etc., don't care about the patients anymore. It's all about self-enrichment. Do you find that, this image needs to change? Because where you are, in the space that you are, you find that there is very much more a change towards ethical governance, leadership, and professionals who are working in these fields. They're doing their job, albeit the very difficult circumstances in which they find themselves in.
So I don't think it's true that care has deteriorated. I actually just received an email from a patient this morning complimenting the care she received in her diabetic clinic yesterday and complimenting the doctors. So there is still a lot of good out there. The problem is that we are strained due to budgetary cuts. The pandemic has left us our purse strings have been cut financially. I don't think Gauteng Health is in a good situation. But there are people in the ground doing their work. 10 or 20 years ago, I think our governance principles that are being implemented now, I know there have been a few bad occurrences here and there, but at the hospitals that I work at, I think in terms of clinical governance and corporate governance, things are better. We've had a very strong leader during the pandemic in Dr. Matabula, who has just left us. But, we were led by a strong female leader during the pandemic, looking after most of Gauteng North's patients. We've had no sort of negative in terms of procurement or any of the scandals. We haven't been in any of the scandals. So there are good things happening. There are challenges at all places, but I think we are trying to do the best we can under the difficult challenges. And if we're looking at rolling out universal health care, we've got our purse can hold so much of money, and we need to see how we can spread that purse to cover all our population. Previously, there were people who had no access to healthcare at all. And I think things are changing. There is a lot of good being done. And we just all need to continue working and going forward. Even if it's 1 step back and 2 steps forward, we need to just see that we're going forward.
And so in 30 seconds, what do you think are the values that we need to see most in South Africa?
At this time, I think hard work, commitment. All our state institutions must be run by people who have ethical and good moral values, and they must be held accountable.
Thank you very much, Professor Soma. Thank you for this time and for sharing these wonderful insights with us today.
Pleasure. I hope it was okay.
It was excellent. Thank you so much. Bye-bye.